Hello, I'm Dr. Kristen Doss, and I serve as the Chief Medical Officer for the Indiana Department of Correction. This message is for offenders in Department of Correction facilities, as well as for friends and family with loved ones at a facility, and is also for all staff that work at the Department of Correction, their family members, and the general public. We, along with the rest of the world and the nation, are continually adapting our response to the virus. Because, as we have said before, all that we've done and continue to do is to protect the offenders at our correctional facilities as well as our dedicated staff working for the Department of Correction. Now, while it isn't possible for me to touch on everything we're doing to limit the impact of the virus, I do want to give everyone an update. Some of this is information you've already heard and some will be new. I'll start with the things we are already doing and will continue to do. Visitors and volunteer staff have been suspended from entering correctional facilities. Department of Correction staff who are sick, regardless if their illness is a simple cold or could be due to exposure to the COVID-19 virus, are not allowed to work. We continue to reinforce with staff and offender alike to follow personal hygiene best practices recommended by the Indiana State Department of Health and the Center for Disease Control. And you can help reinforce these important practices when you write letters or have telephone or video visits with your loved ones. Remind them to wash their hands frequently, and if they need to cough or sneeze, to do so into their shirt sleeve, and as practical as possible to keep their distance from other offenders as best as they can. And so all offenders and staff are able to wash their hands frequently, we continually resupply soap and hand sanitizer at all correctional facilities. Deep cleaning of all facilities is an ongoing practice, and any facility suspected of being impacted by the virus receives additional cleaning. For family of offenders and our staff, there is information on the Department of Correction website about the virus and our preparedness and response plan. Now, here are some additional things we've been doing to minimize the spread of the virus. Any staff exhibiting signs of sickness have their temperature taken, and if they have a fever, they are sent home. Department of Correction staff who interact with offenders have received and reviewed plans for isolating symptomatic inmates from each facility. These plans include contingency plans if large numbers would become infected simultaneously, to include the repurposing of facility gyms. Offender work crews have been canceled and non-essential work release has been canceled as well. Critical offenders who work in food service and those making personal protection equipment are in separate housing areas to further reduce the opportunity of the virus to spread. And related to the offenders making personal protection equipment, the hand sanitizer, face mask, and protective gowns being made are for use in our correctional facilities, so we don't impact the supply of these items in each of your homes. Also, correctional facility staff are constantly monitoring offenders for virus-related symptoms. And to help with social distancing, floors have been marked with 6-foot intervals. Lastly, every workday, there is a briefing between the facility wardens and Department of Correction executive staff for the latest updates for each facility. While this is far from everything we are doing, I do hope it gives you all who have watched this video a better understanding of our commitment to protecting offenders and staff alike. Thank you for watching, and remember to visit the Indiana Department of Correction website for more information.